Great to be here with you here tonight. So tonight we're going to do how to use acupuncture points and nutrition to sleep better. And I don't know if you've ever had trouble sleeping. I've certainly gone through, I've had like periods of tough sleep and then periods of good sleep. And so for me, this was a personal journey, and also, of course, for my patients, because it has so many effects on the overall health of the individual. Let's take a look. Tired, irritable, forgetful. These could be signs that you or your patients are not getting enough restful sleep. In this webinar, I'm going to show you how to use the power of nutrition and acupuncture to help yourself and your patients have a good night's sleep. Studies show that poor sleep is linked with a range of health problems, from trouble concentrating to weight gain. Poor sleep is also linked with a weakened immune system, a low sex drive, an increased tendency to have accidents, high blood pressure, and poor balance. So I've created this brochure for your patients. This, of course, is the front page. And they can click here to watch the video you're going to see in a couple of minutes. And this is the page that tells them how to find the acupuncture points with the directional terms and the Chinese acupuncture measurements. Over here are the actual points you're going to learn about today. These I call the sleep points, low Zen, conception vessel 12, and heart 7. We'll see a lot of that in just a couple of minutes. On the next page is the actual standard process supplements. And I'll tell you, I've been through a lot of different programs trying to get my patients, trying to help my patients sleep better. And I've hit upon what I think is one of the best, and I've memorialized it here for you. And you can see we're using Orchex, 4 before bed, Choline, 3 at dinner, 3 before bed, Calcium Lactate, 3 times a day, Neuroplex, Valerian complex. And that is your basic pattern. We'll go over those in more detail in a minute. And then you can also consider high-grade licorice liquid, organically bound minerals, Cataplex G, Protofood, AC Carbamide, and calcium lactate. And I'll go over with you the reasons why you might want to select those for a patient or maybe not. And then I've included the all-important medical advice disclaimer page to keep you and your patients on the safe side of things. Now, a quick advertisement. I've created 4 courses for your patients. How to heal a concussion fast, healing from the ground up, improving erections, new hope for Alzheimer's, and carpal tunnel syndrome. So these courses are available to your patients. And if you, each course takes about 3 or 4, they're about 3 or 4 weeks long. And through supplements, downloads, video instructions, quizzes, and real-world assignments, patients learn they're actually trained how to help themselves. The courses cost $199. Okay, let's get on to the supplements. The first, and these supplements are in the order of importance. If the person can only take one, this is the supplement for them. Orchex, 4 before bed. It has a potent calming effect that helps maintain emotional balance. It encourages mental clarity. It enhances a person's ability to relax, and it enhances adaptability to life stresses. It supports the balance of the central nervous system. So that's Orchex, 4 before bed. If they can only take one, that's the one, but ideally they should take the full protocol. The next one is Choline, 3 at dinner and 3 before bed. Now, choline helps emulsify fats, and therefore it supports the healthy nervous system, because the major nerves in the nervous system are all coated with a sheath, a myelin sheath that's primarily made up of fatty acids and fats. And when there's not enough digested fats in the body, not enough essential fatty acids, then the sheath begins to break down, and you basically get interference or interruptions to the nerve flow, a little, what you can think of as like a short circuit. So anything that digests fats supports a healthy nervous system. And if the nervous system is firing smoothly, people feel more relaxed. This supports liver and gallbladder function because the liver and the gallbladder do the first processing of fats, and it supports detoxification because it's supporting the liver. 3 at dinner and 3 before bed. Calcium lactate tabs, 3 twice a day. This supports muscle contraction and relaxation. It supports nerve flow, supports proper functioning of enzyme systems, and immune support. Calcium is needed for almost all of the body's reactions, and that's why you have a huge bank of calcium in your bones and your teeth. There's a small amount of maybe 2% of the calcium in your body is soluble, but there's a huge bank there in case it's needed, and that's why nature put it there. Nature could have made bones out of magnesium or iron. Body has iron, it's in every blood cell, so body can certainly manage iron, but it selected calcium because calcium is so key for other events in the body. The next is Neuroplex, 2 upon arising and 2 before bed. Neuroplex supports the nervous system. It supports clarity of thought. It supports the endocrine system. So disturbed nerve function leads to mental confusion or depressed mood. If you doubt that, just think about the last time you stubbed your toe or you banged your elbow. That resulted in disturbed nerve function. And if you're anything like me, you then felt maybe a little, your thinking might have been a little disturbed, at least for a couple of moments. The next product is Valerian Complex, 1 with dinner and 1 before bed. Now, valerian, this is actually a root, and it's said to relieve nervous tension, relieve occasional sleeplessness, promote relaxation, and ease the effect of temporary or occasional stress. Valerian is known as Valeriana officinalis, and it's a flowering plant native to Europe and Asia. The root of the plant has been used as an herbal remedy and to treat insomnia for thousands of years. We can trace the use of valerian back to Greek and Roman empires. And it was noted by the great Greek healer Hippocrates. He used it to treat headaches, nervousness, trembling, and heart palpitations. Valerian root, 1 with dinner, 1 before bed. And the beauty of this is it does not impair cognitive function or fine motor skills. So you can take it in the morning before driving and there's no problem. Whereas if you try to take a sleep medication in the morning, there's a warning right there, do not operate heavy machinery. So that's it. That's the basic protocol. This will really get a patient on the right track. Also consider licorice high grade. Now, this is standard process has 2 licorice liquid products. One is the basic licorice, and then they have the licorice high grade. The price isn't that greatly different. I recommend use the best product available, which is the licorice high grade liquid. And it's 1 teaspoon upon arising and 1 teaspoon before bed. That's right. Even though it helps with sleep, it's 1 teaspoon on arising because it basically calms and balances the nervous system. It helps it adapt to the normal circadian rhythm. So in the morning, it gives a calm, relaxed, energetic approach, but in the evening, it gives a calm, relaxed, sleepful approach. It promotes adrenal gland function, promotes healthy response to environmental stressors. Now, it's licorice, so it's contraindicated in high blood pressure, edema, cognitive heart failure, congestive heart failure, low blood potassium, pregnancy, and lactation. So it's not for every patient, but for most people, it's going to be a perfect product for them. Additionally, it supports the GI tract, and it's great for healthy lung function. And anyone who has any upper respiratory infection, and we won't name any, but any respiratory infection, give them all this stuff right here. Have them take a teaspoon of that 1 to 3 times a day. Let it slowly go down the throat, and it soothes certainly the upper GI, and it gets into the lungs and just soothes the lungs. Now, licorice root is also an herb that has a long history of use. It's cultivated throughout Europe, Asia, and the Middle East. Now, many of the licorice products sold in the US today do not contain actual licorice. They contain anise oil, which smells and tastes like licorice, but it has none of the beneficial effects. So that's just one more check the box reason why I'm getting my products from Standard Process and MediHerb. I know I'm getting the correct product, the right species, and certainly not getting some false anise root that just smells and tastes like it, but has no beneficial effect at all. Licorice root has a long history of use going back to ancient Assyria. And Assyria was from the Middle East in the area of land now known as Iraq, but it was used way, way back, thousands of years ago. The Egyptians used it, the Chinese used it, the Indians, they used it as part of the Ayurvedic tradition of healing. This product is a winner if you can get the real high quality licorice, which of course I rely on Standard Process MediHerb for. It was traditionally over the hundreds of years used for treating lung problems, liver problems, circulatory problems, and kidney diseases. So if any of your patients has any of these things, we're not saying this is going to cure them, but ask them if they want to feel better. Ask them if they want to feel relief. They're going to say, yes, yes, please. When I say to my patients to set them up for this, I say, well, would you be willing to take this product if you could feel 20% better? And I know I'm going to get around 60 or 80%. They go, yes, yes. So I set the expectations low, and with this product, I deliver high. Colocol. This is for anyone who has any gallbladder issues, 3 before bed and an additional 3 if they wake. It helps break down fats, supports gallbladder function, and supports healthy elimination. Now, it contains purified bile salts with collinsonia root, which supports vascular wall health and lessens the chance of having hemorrhoids and varicose veins, which can be aggravated if bile salts are given alone. So this again shows the beauty or the genius of the Standard Process products. Now, those of us who grew up in the West, unlike my friends in Asia or who learned traditional Asian medicine, we didn't know about the value of bile salts. But actually, in traditional Chinese medicine, there are 42 different animal bile salts obtained from both vertebrates and invertebrates, including human bile, that have been used for centuries for a host of illnesses in traditional Chinese medicine. Beginning with dog and ox bile, very famous, the carp, and this was first started in the year 1046 BCE, before the Common Era in the Zhou dynasty. Overall, different animal biles were prescribed principally for the treatment of liver, gallbladder, skin, including burns, gynecological, and heart diseases, as well as diseases of the eyes, ears, nose, mouth, and throat. When you really get into treating patients with bile, this will open up a whole new area of practice for you. Maybe someday we'll do a seminar on bile by itself, but suffice to say, this is a great choice for a lot of patients. Now, organically bound minerals, another beautifully constructed product, and this is for sympathetic overload, 4 with dinner, 4 before bed, encourages healthy enzyme functioning, supports the nervous system, contains iodine to help with thyroid function, helps maintain proper energy, promotes connective tissue healing. That means injury healing. So, you can get minerals all over the place. They have these liquid minerals and minerals they get out of Dead Sea and everything else. But what's different about those minerals than organically bound minerals? Well, those minerals are just minerals. But what Standard Process does is they take this mineral-rich soil and then they add minerals, liquefied minerals to the soil and feed the plant. Then the plant sucks the inorganic minerals up into the plant and binds them into an organic compound. So these are truly organically bound minerals, and they go into the system much better than rocks. I mean, you're getting powdered rocks when you're buying minerals in a lot of places. And I'm not saying those aren't valuable, because they are valuable, but they just don't hold a candle to organically bound minerals, which is why I use this in my practice. And if you check with Ben, it's probably one of my best sellers. Now, Cataplex G, I use this for anyone who has a tendency of high blood pressure. 3 at dinner, 3 before bed. Maintains healthy nervous system, provides a calmative effect on the nervous system, encourages healthy parasympathetic nerve functioning, supports healthy liver functioning, supports the brain and nervous system function, and supports metabolism. Protofood. This is for anyone who has excessive wakefulness, 4 before bed. I call this my turkey dinner supplement, because this contains the essential amino acid tryptophan. And as you know, essential amino acids cannot be created in the body, therefore you have to take them. And it's tough to get high quality essential tryptophan unless you're eating turkey every day. This is a great alternative to melatonin for your patients, because it can do anything that melatonin can do. And melatonin does have a little downside, which can cause the production of brown fat, which is what bears use when they hibernate. The only problem with brown fat is the only way to burn it is to exercise in cold weather. So patients who are taking a lot of melatonin over time can build up this brown fat, and then they get this fat they can never lose. So Protofood, a great alternative. AC Carbamide, if the person is having nightmares, this is the product for them. Supports healthy fluid transfer among tissues, promotes healthy formation and excretion of urine, promotes healthy blood fluid levels. Take this during the day, not before bed, because it promotes healthy urine flow. Who wants to promote urine flow just before they go to bed? Not your patient who's having trouble sleeping. So take it during the day. It'll help balance the fluids in the body, and then patients, surprisingly, will not have nightmares. Magnesium lactate. If the patient craves chocolate, they are deficient in magnesium. This is the product for them, and this may be the keystone that'll help them sleep better. Now, we're going to go to our video, how to use acupuncture points to sleep better. All right, I have a slight correction to make. During the video, I was referring to conception vessel 12, but I misnumbered it and misnamed it as conception vessel 14. So the name is wrong, but the location is exactly right. So if your patients just follow the location, they're going to be in great shape. So let's take a look and see the video that your patients will be able to see when they start this program.
Hello, in this video I'm going to show you how to use the power of acupuncture to have a good night's sleep. Do you feel tired, irritable, or forgetful during the day? These could be signs that you are not getting enough restful sleep. By the end of the video, you will have learned the 3 most important acupuncture points to promote restful sleep and how to stimulate them to get a good night's sleep. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in medical acupoint therapy. I've helped thousands of people live healthier and happier lives, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos come out. Studies show that poor sleep is linked with a range of problems, from trouble concentrating to weight gain. Poor sleep is also linked with a weakened immune system, low sex drive, an increased tendency to have accidents, high blood pressure, and poor balance. Whether you have long-term problems sleeping or occasional trouble falling asleep, these acupuncture points are designed to help. These points are most often used before bed, but can be used anytime during the day to promote relaxation. The first acupuncture point to stimulate is called Low Zen. In addition to helping with sleep, Low Zen is used for digestive problems, shoulder pain, and neck stiffness. Locate Low Zen on the back of your right hand just before you get to the knuckles between the index finger and your middle finger, right about here. Now press in till you find a tender spot. It could be just a little bit higher or a little lower or off to one side. Stimulate the point by rubbing the area quickly 5 times. Then take a break for a count of 5 and repeat 4 more times. Next, find low zen on your left hand and do it again. During or shortly after stimulating low zen, you might notice a sensation of heat or energy in your hand, arm, chest, or neck. This is normal and temporary. After stimulating low zen, take a few deep breaths. Open and close your hands, stretch your arms, and just notice they might feel more comfortable and more flexible. The next point is conception vessel 14, known as the Great Gateway. In addition to helping with sleep, conception vessel 14 is used to relieve symptoms of acid reflux, nausea, and palpitations. Conception vessel 14 is said to calm the spirit by reducing nervous system overload. To locate conception vessel 14, place your hand over your umbilicus, place your other finger just above that hand, and push in with deep pressure. You're looking for a tender or painful spot. The spot might be just a little higher or a little lower. Once you've found conception vessel 14, stimulate it by rubbing 5 times quickly. Then take a break for a count of 5 and repeat 4 more times. After stimulating conception vessel 14, take a few deep breaths and gently twist from side to side. Your core may feel stronger and more stable. This is a great point to do before or after exercise. During or shortly after stimulating conception vessel 14, you may notice a sensation of heat or energy in your abdomen, back, or chest. This is normal and temporary. The third and perhaps simplest way to promote sleep is Heart 7. Heart 7 is known as Spirit Gate. In addition to promoting sleep, Heart 7 is used to help with chest pain, irritation, poor memory, and rapid heartbeat. In Asia, Heart 7 has been used to help persons with autism. To find Heart 7, look at the palm side of your right hand. You'll notice there's a crease just at the base of your palm. There might be a couple of creases. In that case, select the crease that's closest to your palm. Follow along till you reach the pinky side and push in and find a spot that's tender or painful. That's Heart 7. Heart 7 is best stimulated by a gentle tapping with your finger. Remember, this point should be stimulated with a gentle tapping, which should not be painful or unpleasant. Tap rapidly 5 times, rest for a count of 5, then repeat 4 more times. Now find Heart 7 on your left hand and repeat. During or shortly after stimulating Heart 7, you may notice a sensation of heat or energy in your hand, arm, chest, head, or face. This is normal and temporary. After stimulating Heart 7, take a few deep breaths and see if you notice some heat or energy in your face or ears. If you have trouble sleeping, I recommend that you stimulate these 3 acupuncture points every day for the next 30 days. You may feel more relaxed within minutes of stimulating these acupuncture points, and many people get a great night's sleep. If your sleep does not improve right away, just keep at it. These points have been helping people sleep better for thousands of years. I hope that you have a great night's sleep. Till next time, this is Dr. Baritz signing off, yours for health naturally.
So that completes the video. In this webinar, we covered problems associated with poor sleep. We covered a basic protocol of supplements and herbs to promote sleep. I went over the acupuncture protocol of the 3 key acupuncture points to promote sleep. And I gave you a quick reference guide for your patients. Is there any questions that I can answer to help you help your patients sleep better?
Yeah, we do have a couple questions. First question. Well, they're different topics, but you're okay with that, right?
Sure, of course.
So we are stimulating CV12, not 14, at the location that is shown on the video? Question mark.
The answer is
what
yes.
You said.
The location is CV12. you know, I must have had too much coffee that morning because I mentioned CV14 in the video, but the location was CV12. That's the point.
Wonderful. Another question came in, let's see, in the comments section, which is, aside from people saying they'd love to continue the series, someone
Oh,
said
great.
you talked about doing a series for use in pets in the new year. So maybe showing acupressure points with the pets and potentially
Yes. And
nutrition.
so I've been doing a lot of studying, treating animals, and I already treated some dogs. And so I can see how it works. And I'm going to be doing a full, if I do the seminar again, you know, Ben, if we decide we're going to do it, then I will do at least a couple of them on pets showing, you know, the acupuncture points for the pet and the veterinary product to pair them with.
Excellent.
Yeah.
And then one last question that's in so far. And again, type in your questions in the Q&A box. And if you have any comments into the comment box, please. We still have another minute. Could you please share your source for the point indications? Thank you. I don't know if you can do.
Well, in terms of the selection of that, so anyhow, I use a book called Pictorial Atlas of Acupuncture, and it's a beautiful book. It's fully illustrated, and it has actually 3 pictures. I don't know, maybe I can kind of see if I can. Anyhow, it has the explanation of the acupuncture points, and it has 3 pictures. It shows one with sort of a X-ray view or a anatomical view, and then it shows one with a picture of a person's body with the acupuncture meridian drawn in, and then it shows a picture of the person's body with the needle in place. So they really went over the top to, and I use that as my most authoritative reference guide. It's one of the best reference guides that I could find anywhere. Surprisingly, originally, the original versions of this book were like, I think in the $200 range, but now with publishing and everything, you can pick it up for under $50.
Great. Here's like a 2-part question. You don't really have to answer it now because we're out of time, but any points that help chronic low back issues, I'd love to have a class on low back issues if possible. So notes for the future.
Yep, I made a note of that.
And if you want to talk about a point really quick or something about that, if you want to speak to it for briefly, you may.
Well, I will simply say bladder meridian. That's the classic meridian for treating back pain. And depending on how severe the back pain is, I would start with the bladder meridian points around the ankle and work my way up the leg. Works for sciatica too.
Great. All right. I don't see any others. What's the first part of the name of the acupuncture book?
Oh, so the book is called Pictorial Atlas of Acupuncture, an illustrated manual of acupuncture points, and it's edited by Hans P. Ogle and Wolfram Stor, S-T-O-R, and it's published by H.F. Ulfman, U-L-L-M-A-N-N.
Right. Well, looks like it. So until next week, I'll say everyone have a great evening, and lots of thank yous in the chat box for you, Dr. B. And
such a pleasure.
Yeah, everyone have a great rest of your week. Continue to get people healthy. If you want the sports recovery packs, we still have those. Buy one, get one free. Just shoot me an email. And other than that, have a great evening, everyone. Thanks for joining us.
Good night, Ben. Thank you.
Good night.